Welcome to the University of Washington School of Nursing Voices of Nursing podcast, where we dive deep into the diverse and inspiring stories from the heart of healthcare. This is Voices of Nursing. Today we are joined on Voices of Nursing with Dr. Aisha Brooks, who is a retired captain of the U.S. Public Health Service Commission Corps, having dedicated over 20 years of distinguished service with over 30 years of service spanning nursing, public health, and executive leadership. Dr. Brooks has also launched VitalVoice Nursing, LLC, a company dedicated to empowering nurse leaders, driving systemic change, and addressing population-level health challenges. The UW School of Nursing is thrilled to be joined by such an established and committed nursing leader. Welcome and thank you for joining us today, Dr. Brooks.
Excellent. Thank you for having me.
And we also are going to be graced by your speech tomorrow at the lecture for health promotion.
Absolutely.
What will be the topic that you'll be talking about tomorrow, if you don't mind me asking?
Sure. Tomorrow I'll be talking about nurses as architects of systemic change and specifically focused on well-being. Really trying to understand how nurses can be a part of shaping the environments that we're in as opposed to just having to experience and endure them.
Outstanding. And that nurses are very much an agent of that change.
Always.
Outstanding. Well, thank you so much, Dr. Brooks. And we want to learn a little bit more about you and your journey. You've had a remarkable career in nursing and also in public service. So my obviously first question is what started it all? What inspired you?
Yeah, it's such an interesting story. Every time I think about it, I always knew that I wanted to be in healthcare. I enjoyed, taking care of people, showing up for people. But when I was younger, I actually wanted to be a pediatrician. And the reason I wanted to be a pediatrician is because I liked kids. And so it seemed to go together that that's what you're supposed to do. As I chose to pursue college and looking at schools, I ended up on a college tour and visited Hampton University. And to this day, I don't really know how I ended up at the School of Nursing during the tour. But in the School of Nursing, I met the dean. And the dean somehow, we were talking and she understood I wanted to be a biology pre-med major. And she said, well, do you know the difference between nursing and medicine? And, with all the knowledge of a 17, 16-year-old, right?
Oh, yeah.
I gave her my answer and she said, well, physicians treat the illness and nurses treat the person. So as you pursue healthcare, decide which one speaks most to you and pursue that. And it was at that moment that I said, you know what, I actually want to be a nurse. I had never had it framed that way for me, had never understood it that way. But from that moment, I decided to become a nurse. And then, of course, a pediatric nurse, because again, I want to take care of the kids. My first rotation, seeing sick children, didn't work well for me. It just tore at my heart. I had a 15-month-old and she had third-degree burns. And during the time that I was there as a student, I never saw a parent. I never saw anyone. And so I really believe that that was when it really planted in my mind, trying to understand how people experience the situations that they experience. So I came into nursing really wanting to understand how to keep people healthy, as opposed to getting them back to health from sickness. And, that really kind of has been the foundation for everything I've done. And so as a nurse, it's always been my goal to understand how to prevent circumstances like the ones that I saw in school, and then also those that I saw in my early stages of nursing itself.
And did you have a thought of moving from bedside or acute settings into, this other, environment? Did you kind of know you were going into the public service route? Did that occur to you at the time, or was it more happenstance?
I didn't have a name for it. My senior year, I had a rotation in community health, and I completely enjoyed meeting people where they were, whether it was in the clinic, whether it was in their home. But it was just such a different dynamic than seeing people at the bedside that I just gravitated towards that. And when I graduated, it was still the time in nursing where you must start out in med-surg, right? You're not going to go anywhere unless you're in med-surg. And I was like, I don't want to work in the hospital. I actually don't.
You knew.
So my first job was at a subacute care facility, and I always call it that, too sick to be at home, but not sick enough to be at the hospital. So I was able to hone my clinical nursing skills, but also leadership skills, because after about a year, I was promoted to charge nurse, right, to my shock and horror, but promoted to charge nurse. But, it was then that I realized, and I, began to have a voice and understand what the power in being a registered nurse was. But it wasn't until I started exploring how to understand, what I was missing, because I went and completed my master's in nursing immediately after the BSN. And so at that point, I had a choice of administration, education, or nurse practitioner. And again, with all the knowledge of a novice nurse, right, I chose becoming an NP because that's what I had heard, right? That's next level nursing. But I finished the program and realized that wasn't for me either. And so that's when I started to really explore, well, what is it that I need? And what I was missing was being able to impact communities, not just one person at a time. So that's what ended up driving me into public health. And, I did work in the hospital, though. I did have a couple of years I worked as a labor and delivery nurse. Again, never lost my love of babies. But labor and delivery is one of the happiest places in a hospital. And most times people are coming for happy reasons. There are some sad days, but I loved it. But again, I'm reminded when I saw people coming in, didn't have prenatal care or, don't have support systems. Again, it's this, what in the world is going on that folks don't have what they need before they get here in the hospital. So to your point, I understood the value of the hospital, but to me, that's the safety net. That's not where people should start.
And you started to see that there was a need to scale some of this up. So you observed that.
Yes, absolutely. It was more so where are the decisions being made that are stopping people from reaching their highest potential. Because, I moved from subacute care into home health care, which was amazingly rewarding. Left home care in order to pursue labor and delivery in the hospital because I'd always wanted to. And then moved into case management. But it was through case management where I started to learn more of the policies, the rules, the regulations, and the things that, people wanted to do but weren't able to. And that was my first experience in realizing that there are some people who, through behavior, they make choices and they have poor outcomes. There's others that are choosing between two of the worst possible options, and they just have to choose one. And it's no fault of their own, but it's what's available to them. And so it brought me to this mindset of how can I be part of this, powers that be who make the decisions so that people can choose from healthy options. So that's what led me to policy and the federal government because, everyone kept saying, well, HHS rules say. I'm like, well, who are these people at HHS?
Who are they?
Right. Who are they? Where did they come from? Do they actually know what's going on out here? And so that's what drove me into the federal government, is really trying to understand where those decisions are made so that I could bring the voices of the people that I worked with, that I took care of, and also personal experience to be able to say, this is meeting the needs for some, but it's not meeting the needs for all. And so that is, where I really chose to focus in scaling it up to a point that you're creating systems, not just, individual programs, so that, you can help more people. And I firmly believe that if you design systems and projects and programs and policies that focus on the most vulnerable, everyone will be impacted,
Everybody benefits.
Absolutely.
And that designing these things to be accessible is a net good for society.
Absolutely.
I love that. You talked about leadership, and I'm seeing a thread of this draw towards leadership. And a lot of the times folks don't think of nurses as leaders, or at least those who don't know nurses intimately. Those who know nurses definitely think of them as leaders. But, in media and just in general, society doesn't always portray them that way. So what I'm hearing is a really strong thread and theme of leadership in your experiences. And you said it started when you were working as a charge nurse. So how did that come about, and what did you learn? What kind of leadership are you talking about here? What does that look like for nurses?
Yeah, it's a couple of things come to mind as you ask that question. My journey to leadership was not one that I pursued, many of my leadership opportunities happened to me. Where people saw in me something that I didn't see in myself quite yet. So becoming charge nurse, right? I graduated from Hampton University. We always had a joke at school, what do you call a Hampton nurse 1 year after graduation? Charge nurse, right? But it was just a joke,
Yeah.
But certainly it was about 1 year after graduation that I became charge nurse where I worked. And what we had always been taught at Hampton is, you are the standard of excellence. And so no matter where you are, you always show up, and you show up completely, fully, professionally, and you do your best, because that's all anyone can ask of you. So even in those opportunities where, you're given a chance, it's scary at first. My first supervisory job was similar, right? I applied to become a case manager for a Maryland MCO, Managed Care Organization for Medicaid. And they called me back and they said, hey, are you interested in being a supervisor instead?
Oh.
Well, you don't get to say no in that situation, right? Like, you don't say no. As a matter of fact, let someone else do it, right?
Right. It's like
you
there you say.
Right. You take supervisor or nothing.
Mm-hmm.
So, of course, the answer was yes. And I'm so glad that I did. But again, it was another example of when people saw something in me that I did not think I was ready for myself. And what that did for me is it, continued to give me my own self-confidence and self-assurance, but it taught me how to see that in other people and do the same. And so for me, leadership has been a thread through everything that I've done. When it comes to nurses and nursing, I think that we do many nurses a disservice in the way that we've structured nursing education, in that we've created nurses that are waiting to hear the orders that we're following. And so we don't tend to lead with, what we know as nurses and what's in the scope of nursing to determine what is your nursing treatment plan that complements a medical treatment plan or anyone else's treatment plan. And understanding that there are things that nurses can do within our scope that we don't need someone else's order or direction for. And so I think, until and unless we plant that seed when we are educating nurses, it becomes hard to flip that switch. You become licensed and all of a sudden everyone says, sit at the table, have a voice, make a decision, be a leader. And the question is, well, when were you actually taught to become a leader? And when were you celebrated for using your voice instead of quieted for using your voice? And so I think many nurses are leaders. Many don't see themselves as leaders. And that's really where I am today, with creating VitalVoice Nursing, as you mentioned, and specifically for public health nurses, because even amongst the nursing profession, public health nurses are kind of this enigma that if you aren't a public health nurse, you don't really know what they do. We don't necessarily fit well in the public health world. We don't necessarily fit well in the nursing world, right? We bring public health to nursing and nursing to public health, but there's no space in between. And so it's been important for me to help public health nurses find their voices. And then, just as I said before, when you meet the needs of those who are most impacted, it helps the needs of everyone. So through helping public health nurses find their voices, indirectly, it also helps nurses understand how to not only find, but use their voices.
So tell me a little bit more about Vital Voices. So you brought, this is a beautiful segue. Thank you so much for teeing this up. Tell us a little bit more about what it does and how what it does benefits not just public health nurses, but nurses in general.
Absolutely. So it's funny. In retirement, people said, well, what are you going to do? And I said, well, I know what I won't do. I won't be sitting down. I won't be sitting still. Retiring is really reframing for me. It's my opportunity to take everything that I've done, that I've enjoyed, and to package it up into something that's fun for me. And for me, what that looks like is establishing this public health consultancy that is intentionally built from a nursing lens. So as a public health nurse executive myself, I not only get a chance to offer my skill set through leadership development, but I also get to model what public health nursing leadership looks like as a consultant. And so consulting is what I do on a systemic level and organizational level to really help change systems and really help people understand how to navigate workforce solutions using nurses, but also how to infuse that nursing lens into establishing equity and helping their programs. And that's whether it's academic whether it is a healthcare system or hospital system or even a public health agency. Regardless, wherever there are people, there's health and there's a need for equity, right? So that's at the systems organizational level. There's also coaching and executive coaching, because in order to change systems, you've got to start with yourself. And so coaching is a very bold step in understanding who you are, understanding how to lead by who you are, not what you do. Because I think as nurses, we get caught up in titles sometimes, and you don't feel like you have permission to lead until and unless you reach that imaginary pinnacle. And I say imaginary because as soon as you get to charge nurse, now the leader is the chief nurse officer. And as soon as you get to CNO, the leader is actually the systems executive. So you keep moving the bar as you move up. So coaching helps people understand that it's not about what they call you, but it's about how you show up and who you are as a leader. So through the consulting, through the coaching, and then speaking like I am tomorrow, which is an opportunity for me to get out and meet people, which I do enjoy. But also it's, being the thought leader, and I call it planting seeds, dropping ideas, dropping thoughts, calls to action that people can hear, process, take with them, turn it into what they need, and multiply it, grow it, and do amazing things, and then come back and tell me about it.
That's got to be so rewarding when they do. Outstanding. I love, there's so many wonderful seeds you just planted in all of that, and I struggle knowing which one I want to follow. I mean, retiring is reframing. Love that thought. I'm going to hold on to that one. I'm going to steal it. And also this idea of the titular leadership not being the only thing, right? And that there's always going to be another hierarchical role above yours. And if you're waiting for that permission, you might never get it.
Bingo.
Right? So don't wait for that permission. And I also loved what you were saying about introspection, and that in order to have the positive impact we're seeking, we have to also find the things in ourselves that need to be healed, nurtured, supported.
Yes.
Love that. Everything about that's just stunning. So with that, let's go a little bit into some of the other experiences in leadership that you've had. In particular, you were an officer in the U.S. Public Health Service. So you kind of talked a little bit about it, but let's go a little bit deeper into what that experience was like for you. What else did you learn about leadership, public health yourself during that time?
Yeah, so my journey into the public health service, it's funny. I always say when you hear my story, it sounds like a well-written novel, right?
It does.
Someone really thought about it
really
and they put these pieces together. And I promise you, that's not at all how it happened. It just reads well, right?
It really does.
So we spoke earlier about kind of my early nursing years and coming into the federal government. I actually came into the federal government as a civilian at first. And as I started to learn more about the public health service, I realized that it was an opportunity for what I call the best of both worlds, in that I was able to continue in largely a civilian role, but also wear the uniform proudly, and also deploy in service for the country. So when I first became a public health service officer, I was at the Health Resources and Services Administration in HRSA. And there I was leading the Nursing Workforce Diversity Program, which was still one of the best experiences that I've had, being able to impact students, but also meet so many faculty and administrators and deans of schools of nursing across the country. From there, I moved into policy within the federal government, because I realized that even within the federal programs, there's still somebody who's calling the shots. Even in my program, I've still got to follow the rules that someone else has given me. So I still want to go find those people.
You're just looking for it. You're drilling down into the concentric circles. You're like, where's the room where it happens, right?
I don't want to be in the impact of things. I want to create what's to come, right? So moved into policy, also still at HRSA, Health Resources and Services Administration, but that enabled me to expand kind of my perspective in really looking at how to create a nursing workforce that was appropriate and adequate and sufficient and trained for the people in the communities that they served. So whether it was through the National Health Service Corps, whether it was through the Nurse Corps and all the other programs within HRSA that help to address vulnerable populations and underrepresented areas across the country, I really understood better, how we're making a difference, even as the federal government, through our programs and policies. So I spent about 10 years at HRSA, understanding grants management and project management, and just gained a whole host of skills there before leaving and moving on to ASPR, which was then called the Office of the Assistant Secretary for Preparedness and Response. Now it is the Agency for Strategic Preparedness and Response. But that was the first time that I had an opportunity for my role as a public health service officer and my civilian role, if you want to call it, to be one. Because oftentimes officers feel as though we've got our day job and we also deploy. So once I was at ASPR, it was the first time that in my deployment role, I was deploying on a services access team, which was specifically designed to help communities recover after disasters and public health emergencies. So we were there to connect people to resources, whether it was through FEMA, whether there were social needs, whether there are economic needs, really help people get back on their feet after communities have been devastated. And then I took a position that was in the policy office, and it was in the office that identified folks who were at risk, had behavioral health concerns, and also focused on community resilience. So it was beautiful to know that what I did every day also helped to strengthen what I did on deployments. So while I was at ASPR, I had an opportunity to deploy several times through disasters and public health emergencies. I happened to be at ASPR in 2017, where we had those back-to-back Category 5 hurricanes, and deployed over almost 200 days in spurts, both to Texas and also to the Virgin Islands multiple times in order to really reconstitute the social services and healthcare on the island after it was devastated. So that was a beautiful experience for me because it helped me understand how to deploy in a policy perspective as a nurse, as opposed to deploying to provide clinical care. And when I say that, it's in the context that in the Virgin Islands, there is one hospital on St. Thomas, there's one hospital on St. Croix. Both hospitals were decimated. And so when you understand that when we have a disaster stateside, there are states neighboring who can send in support. There are caravans of support coming in from different places. Well, when you're on an island, that doesn't happen. You don't have the ability for that. And considering Puerto Rico had also been hit during that same time, that's usually who the Virgin Islands leans on for support as well. So you are literally on an island and literally feeling as though you were isolated on an island. So that was a very, very difficult but rewarding experience in really getting to know people, getting to know the leadership there, understanding what their needs were to not only build up the Virgin Islands back to where it was, but to build it up even better. So that enabled me as an officer, and I happened to be the only nurse that had been deployed for that particular mission. So that was, I still carry that feather in my hat, very proud to have brought the nursing voice, but I also became the strategic visionary for that mission in really designing how we would approach our support for the island. And again, it was an opportunity to say, wow, I learned this in nursing school, right? This isn't something that I learned while at HRSA or while at ASPR. No, this is actually the nursing process in its highest form, not just for a person, but what is my nursing diagnosis for this community? And how do I look at it through that lens to figure out what we need to do here? So it's more than calling the social worker. It's actually pulling in the Department of Social Services, And so really, again, elevating it to the point that you are community solutions and not people solutions. And it was like one of those eureka moments, because I didn't know what to do at first, but I knew how to assess the situation. And through assessing, and again, following the entire nursing process, you figure out your courses of action, which are our nurses' diagnoses and our interventions. They're called courses of action in public health, right? So we have courses of action for this community. And then what do you do after you try it? You evaluate it, and then you start again. Again, these are the basics and the fundamentals of what we do as nurses. And so it was the realization that when I brought that to the table and everyone was like, wow, wow.
Where'd you learn this?
Right, but for me, I went back to basics. Like, that's what I did, and when you got a little confused, you went back to basics and said, well, how do we do this? And it worked. I didn't have to have all the answers, but what I provided was the structure to find the answers and pulled in the appropriate partners, because again, that's what we do as nurses. We're collaborators, we're conveners. And so knowing what's needed and figuring out who needs to come to the table to make sure we have what's needed for that community. So that was just an amazing experience. Hard, having deployed so many times. My family felt the impact of it. And that was on the heels of having deployed for the Ebola crisis. It was only 3 years after that. So my family was feeling the brunt of that a bit. So my last duty station was at the Department of Homeland Security, where I just decided to do something different, taking my policy knowledge to a new, completely different place.
As you have had the tendency to do.
Yes. And it was, moving from a health agency to a law enforcement agency, and, not realizing that in HHS, everyone speaks health. You might have a different thought on how we get there, but everyone's goal is health, and then you step into a law enforcement agency and everyone's goal is law enforcement, and so it was a very, very different atmosphere. But as always, I'm open to the challenge of trying to understand where we can all agree, because that's really where I start. We may not agree on the same things, but we can continue to elevate the conversation to get to what we do agree on.
Right.
And from there, we can then build strategies. Because as long as we've got agreement that we're working towards the same goal, then you can gain a higher level of respect for how I'm trying to get there. I can understand and accept how you're getting there. I wouldn't have done it myself, but I get it. And I know we're trying to get to the same place. And so that's really how I approach my policy role there. And again, with the same passion, though, of really protecting another vulnerable population and making sure that people who were detained within Immigration Customs Enforcement, where I worked, regardless of why they were there, when they became our patient, they were patients first. And so we're treated with the same dignity and respect as anyone would and seeking healthcare in these United States.
Which fundamentally, I can't think of anything more patriotic than that.
Yeah.
Right. Well, thank you so much for sharing all of this wonderful journey of yours. And I'm seeing this desire to intensify and to scale up your impact at every role you've been at, right? And now that you're working in Vital Voices, it feels like that's the next step of elevating, expanding, and having impact, maybe not just in the public sphere now. Now it's like you could have impact in the private sphere, you can have impact in academia. What do you think is next? I'm curious.
It's funny. I think at every turn, I've asked that same question that you've asked me. When it came towards the end of my career in public health service, I had spent 4 years serving as chief nurse of the public health service, which also afforded me the ability to represent not only our service, but the country on the world stage, right? We don't have a country level nurse, and so we select the chief nurse of the public health service to represent the United States for the World Health Assembly, for the International Council of Nurses. And after experiencing that for 4 years, which coincided with the COVID-19 pandemic, I asked myself that same question. Where do you even go from here? What do you do from here? And that really, is where the Vital Voice Nursing came from, because I did stop and think about, well, what were all the things that you enjoyed as chief nurse? What were the things that you would have just kept going, and, had fun?
They just light your fire,
Exactly.
get you excited every day.
What gets you up in the morning? And that's exactly it. So when you ask what's next, I think, my goal with Vital Voice Nursing would be to provide a voice for every single nurse in this country. Period. right? At the end of the day, that is the most basic and fundamental point, is that every nurse in this country feels that they have an opportunity to speak their true self, whatever that true self may be. And the caveat, though, is you're speaking it through the nursing lens. And so for me, that's all I ask. Because when it comes down to nursing and nurses understanding what nursing does, it really is to be the voice of those who do not have the ability to use their voice themselves. Mm-hmm. People who are challenged in obtaining their highest sense of health and well-being through no fault of their own. And as nurses, we understand that dynamic and that engagement of a person with their environment. And then we can speak life to it. And we can build the strategies to address it. Mm-hmm. And so it doesn't matter where you're working. It doesn't matter what setting. It doesn't matter if this is your first day after you've become licensed or if it's your 25th or 50th year. You're still a nurse, right? But I think it's equally important that every single nurse use their voice to help people understand what nurses do. Not just what they see on television, not just that one time that I went to go visit my cousin, my aunt, my grandmother in the hospital, and that nurse was so nice, right? It's nice to be nice. That's wonderful. That's admirable. But we're more than nice. We're more than nice. And so, my goal is to, again, have that be reality in this country, that people will understand what nurses do. And more so what nurses can do. And then coming back to public health nurses, it is the goal to see public health nurses in that same light, being able to understand public health nurses as health strategists for communities in the same way that we see nurses as the strategists for the patients that we see, whether it be in the clinic, in the primary care office, in the hospital, no matter where we cross paths, the schools. So I think that's, and if I keep that as my what's next, I'll never get bored.
Never. And frankly, this couldn't have come at a better time.
Yes.
Our country needs these kinds of resources, and people need leaders like you who can pass on what they know and build ideological bridges, which is something that I'm hearing in there as well.
Yes. Because again, fundamentally, when you can agree, right? And I go to, I get people to chuckle oftentimes, and I say, can we agree that no one should die? Okay,
let's start there.
If we can agree, then we are on the same page. And I tell people all the time, at the point that someone says, no, I don't agree with that, I think I'm stuck. But so far it's worked. So
far, we'll just keep knocking on wood that it keeps working.
But it's, even when there are ideological differences, even when there are political differences, even when there's all the noise and the extra, it's understanding that we can agree that we want people to be healthy. Mm-hmm. We can agree that people should have an opportunity to be healthy, right? We may go about those things differently, and that's okay. But even when someone chooses to do something that you wouldn't do yourself, as long as they're not causing harm to themselves, causing harm to others, my only job is to make sure they have an informed decision. That's it. I can make sure they have the correct information, and then the decision is theirs. Because again, that's who I am as a nurse. I have to respect your ability to choose and respect that you may choose to do something that I might not agree with. But again, if it's not causing a danger to you, it's not causing a danger to anyone else, then it's on me to just deal with my emotions.
Which that's kind of that internal work you're talking about, right?
Exactly.
Well, this has just been wonderful having this time with you, Dr. Brooks. Is there anything else that you would share with the audience that you feel they really should just know about, whether it's public health, whether it's the role of the public health nurse, the future, anything? What comes to mind?
Yeah, I would say that the time right now is ideal for nurses to step into the room, right? You don't need an invitation. Just walk in and actually become decision makers. This is the time that our voices need to be heard. We are large in number, We can organize, we can communicate, we can speak with one voice, but it is now that nurses, as the most trusted profession, have an opportunity to step up and speak out and really begin to strategize to design what the future of health looks like. We don't have to go back to what it looked like. That no longer exists, right? At this point, we have an opportunity to create something that is even better than what we used to have. And with nursing in the forefront, it can absolutely be better. So for any nurse, no matter where you are, no matter where you work, no matter if you are retired, find that one thing that you can do. And even if it is only one thing, keep doing it, because everyone has an opportunity to be in effect right now.
Chills. Thank you so much. I'm not even joking. I don't say that unless it's real. That's just absolutely inspiring. And I think at this time, we all need a little hope, regardless of where you are. We all need to hear that. So thank you for coming on the show today and sharing that message. It's so, so wonderful.
You're welcome. Thank you for having me. This has been great.
Thank you for tuning in to University of Washington School of Nursing's Voices of Nursing podcast. Join us next time as we continue to explore topics vital to nursing, health, and well-being. Until then, stay informed, stay inspired, and stay engaged. And don't forget, follow Voices of Nursing wherever you listen to your favorite podcasts so you'll get every show as soon as it's released.